Hey everyone, I'm Dr. Kelly Starrett with H-Wave. Clearly we have a great model to help reperfuse and decongest the shoulder using the H-Wave, even getting non-threatening muscle contractions to normalize how my brain is appreciating what's going on with my shoulder. But it can seem overwhelming about what the next steps are. So when we're working with our patient and our athletes, what we like to say is, hey, let's think about normalizing and restoring how the shoulder blade articulates with the body. Oftentimes we're thinking, hey, it must be some aspect of the shoulder, but if we can improve the functionality of how the shoulder blade is articulating with the rest of the body, we often see upregulations in the system, so the system works more efficiently. In fact, we can think of the musculature of the shoulder like an octopus that's got arms that spin and position and organize and compress and steer the head of the shoulder. That octopus is then swam into a shell, and that shell is my shoulder blade. So if my shoulder blade is stiff or can't move independently on my body, oftentimes the arms of that octopus are limited in their reach and their ability to position and steer the rest of the body. So what we like to do is say, hey, we can take a single ball here. In this case, I just have a lacrosse ball, but a tennis ball would work. And we can start by putting the ball anywhere in the relationship between the shoulder blade and the body. And so this is an easy place to begin normalizing some of the function. So what's gonna happen is I'm gonna have Lisa just flip on her back. She's on a soft surface here. This could be your carpet. This could be, if you had a bigger ball, your bed might be a little bit too soft. But I'm just gonna have Lisa place that ball somewhere in her trap and neck area. So a little bit higher up, believe it or not. Now the magic here is that we're always trying to say the first order of business is how do we restore motion. So the first thing I just need Lisa to do is take some big breaths in and big breaths out. Now if this is uncomfortable laying on the ball, that's okay. That's probably gonna be your experience. And know that you're not going to be doing any tissue damage or harm in this situation. If this is the first time you've ever mobilized these tissues, they may be a little bit uncomfortable to compression. That means we've actually found something that we can improve on. So the first order of business is thinking, can I take a full breath in and out in this position? And as Lisa does that, she's expanding her rib cage and contracting her rib cage, and we're starting to mobilize those tissues. And what you'll see is that if it's a little sensitive, just 4 or 5 big breaths, it'll start to desensitize. It'll start to be a little bit more comfortable. Now that's the way we can do that with the ball anywhere in the reference area between the shoulder blade and the scapula, or the shoulder blade and the body. But one of the things we can do is begin to start adding some motion in. So if Lisa starts to put her arm over her head slowly and add some motion in, she's giving context to that tissue system, and she's starting to ask that shoulder blade to move. So notice that she's taking some breaths and she's just simply moving that arm overhead. Now we've got theoretically a whole lot of real estate that we can mobilize here. So she might just spend 30 seconds to a minute there, and then she might just move that ball down a little bit. She can spin the arm out into an angel kind of like position, so she's giving a snow angel. She could reach across her body. What's really great is in this position, she's comfortable and empowered to just take some breaths and spend a little bit of time. For the first dose, we say, hey, let's get 5 minutes on the left side and 5 minutes on the right side. Keep an eye on taking big breaths in and big breaths out. Add a little context with shoulder motion, and then stand up after 5 minutes and test and retest. How does your shoulder feel? Does it feel more stable? Does it feel stronger? Does it feel less painful towards movement? But all the while, one of the fun things that we're doing here is that we're putting in a lot of motion in a context that our brain may not appreciate as sensitive, because we're laying down and the structures and the mechanics are a little bit different organization. That may give us insight, our brains a break, and saying, hey, look, I have pain going overhead, but in this position, I don't have pain going overhead. So it can be a really powerful way to start untangling what can feel like a Gordian knot. So keep using our H-Wave to decongest and to get more blood flow in that system, to get non-threatening movement in, but grab a ball, lay on your back, gets comfortable, and spend 5 minutes working on that area in and around your shoulder blade as it relates to your body.